Great. So welcome, everybody. I know there's some folks who are watching online as well. And this is a meeting of the Essential Support Workforce Advisory Committee. My staff has taken to calling it as WEC. We're waiting for a few more people to join, but we are going to go ahead and start, I think, with introductions. So I'm Jess Maurer. I am the Executive Director of the Maine Council on Aging and the co-chair of this committee. So I'm going to turn things over to Catherine to introduce herself.
Yes, I'm Catherine Thibodeau. I'm the Executive Director of Independence Advocates of Maine. I'm serving on this committee as vice chair and representing Maxby. And somebody, I don't know who did it, but can my name be correctly spelled? It's Thibedeau. Thanks.
Excellent. And so we're going to just turn to introductions from other members of the committee. So how about if we go to Stephanie?
Good afternoon, I'm Stephanie Hatcher. I am the Director of Training and Onboarding for Northeast Residential Services. I'm serving on the board as a direct care provider. I also represent I can never remember the Maine Council Advisory Board.
It's a long name.
It is.
The Workers Advisory Committee. Yep.
Yes.
Yep. Perfect. How about you, Dan?
Good afternoon, Dan Bellier, Chief Workforce Development Officer for the Maine Community College System. Good afternoon.
Good afternoon. And how about you, Michael?
Yes, good afternoon. Michael Smith with Catholic Charities Maine, and I'm serving for the Independent Support Services or the Homemaker program.
Terrific. Sorry, how about Betsy? Sorry, you're all.
Hello, I'm Betsy Sawyer-Manter. I'm the CEO at Seniors Plus, and I'm representing care coordination agencies.
Terrific. Angelina.
Hi, everyone. My name is Angelina Cluthis-Jean. I work in the Bureau of Employment Services at MDOL. I serve as the Director of Strategy and Innovation, and I oversee our healthcare initiatives like healthcare training for me.
Great. Donald.
Hi, Don Dufour. I'm the Chief HR Officer at Tri-County Mental Health Services.
Great. Gloria.
Hello, I'm Gloria Noyes. I'm the Assistant Director over at Westbrook Regional Vocational Center, and I'm representing career technical education in the trades.
Excellent. And let's see, Jess Picard, and why don't we do some, so these, I think the rest of the folks here right now, as far as I can tell, are with DOL. So we'll do introductions there.
Hi, everyone. I'm Jess Picard. I'm the Communications Manager for the Maine Department of Labor, and I'm just kind of hanging out in the background today as tech support.
Perfect. And Dylan, do you want to introduce yourself?
Sure. Hello, everybody. This is Dylan Murray. I'm the Legislative Liaison with the Maine Department of Labor, and I'm here supporting the team as well. Thank you.
Great. And Catalina?
Thanks, Jess. Hello, everyone. My name is Catalina Piedrahita. I work with the Maine Department of Labor at the Bureau of Employment Services. I coordinate the Healthcare Workforce Initiative, and I'm here representing the staff of MDOL.
Excellent. Well, thank you all for joining us, and we'll introduce you in a moment, Mark, if that is okay. Actually, Abby just joined us too. If you can hear us and we understand you're without power, maybe you could introduce yourself.
Hey, everyone. I'm Abby Stivers. I'm going to keep my camera off because I'm without power outside of our Pittsburgh library here. I am the Director of Workforce Initiatives at the Office of Aging and Disability Services. I work on mainly 9817 funded FMAP projects for workforce initiatives. Excited to be a part of the panel today.
Outstanding. Great. Well, we met a while back for our first meeting and had a great first conversation. And then Catherine and I met with our friends at DHHS and DOL to talk about an agenda for this meeting, which will predominantly, as we talked about last time, be focused on data. And so the first part of the conversation is going to be essentially, what do we know about the workers that we're talking about? And I actually, by way of update, we're in the process of working on a grant project with the Maine Center for Economic Policy and a group of stakeholders around the essential support and care workforce. And we had a meeting yesterday, and it was clear as mud that we have really absolutely no idea how many workers there are across what categories, even with the people who are the experts in the room around that. So I think answering the question about what data do we have on workers it's a great place to start. And then I think we'll have to be figuring out what recommendations we might want to make about how we could do a better job of collecting data on this workforce, and all the way at the federal level as well. So so we're going to start with that agenda item, which is talking about any data that we have available data on workers. And I believe, Mark, that you are here to help us understand what is currently available for data. Is that accurate?
Yeah, hi everyone. I'm Mark McInerney. I'm the director of the Center for Workforce Research and Information at the Department of Labor. And so here to support the DOL team, of course, and our mission is really all things labor statistics. So what I'm going to do, I think, is kick us off here with a slide deck and try to talk about what data we do have available in terms of Maine's labor statistics and how it aligns with the work of this committee. So if that sounds right, I might share my screen and pull up these slides.
I noticed that we have been joined by, first of all, our good representative, Margaret Craven, and also Tom Newman. So would you mind introducing yourselves?
Thank you. I'm Margaret Craven, and I represent House District 93, which is part of Lewiston. And I'm delighted actually to be on this task force. And I'm out in the hall at the moment, waiting for my committee to start. And I may be coming and going. We didn't start yet, so apologies ahead of time, and hope that so it's recorded anyway, so that I can hear it again. So thanks.
Great. And Tom?
Hey everyone, Tom Newman, Executive Director at Alpha One, on the committee representing an organization assisting people with a disability.
Great. So Mark, take it away. Thank you.
Great. Let me see if I can pull up my slides. All right. Can somebody give me just a comment or a thumbs up if the slides look good?
Slides look good. Oh, actually, they're in presentation mode, or so we're seeing two. We're seeing the first big one and then the little one. There you go. Perfect.
Is that better?
Got it.
Excellent. Okay. All right. So to start off and to kind of frame the available data, I wanted to first introduce two concepts. Here at the Center for Workforce Research and Information, we provide data on a variety of topics, and I think most pertinent here would be our data programs for which we are able to produce job and wage estimates for the state and sub-state areas by occupation. And then we'll talk a bit about our second most, I think, pertinent set of data, which would be job and wage estimates for the state and sub-state area by industry. So first, let's take the concept of the occupation. You know, an occupation is, and in our data, what we do is we collect information from employers. So we collect surveys from employers who report to us job and wage information. And we take that job and wage information and we classify workers into occupations, which are categories, defined categories that are based upon the work that people perform in their jobs, as well as the required skills, education, training, and credentials that people would have to work in that need to have to work in that particular occupation. Employers in Maine are sampled to receive the Occupational Employment and Wage Statistics Survey. This survey is a federal and state collaborative survey program, and our federal partners are the United States Bureau of Labor Statistics, which is part of the U.S. Department of Labor. And we, the state partner, administer the survey in Maine. It is a federal state program that, of course, we support here in Maine, but states throughout the country participate in this program so that, the set of occupations, the way that the data are collected, et cetera, is standardized so that the data that we produce in Maine would be comparable to any of the other state data sets or the federal data. The occupational classification system that we use in this program is the Standard Occupational Classification System. So this is a federal statistical standard that is used by federal and state agencies to classify jobs according to these different occupational categories for the purposes of collecting and disseminating data. So that's the most pertinent set of data, kind of conceptually what the data are, and I'll turn more into some more kind of the specific details that were raised on this agenda in just a minute. But first, I'll introduce the industry concept. And to give you an idea of the difference between, occupational data and industry data, one example would be, a care providing facility or maybe a hospital, for example. The hospital represents and describes the primary economic activity of the employer, and the occupational employment would be representative of all the different types of jobs and tasks that are required to run a hospital. So from an occupational perspective, you would find workers, that are very high skilled, like healthcare practitioners, doctors, surgeons, for example, as well as, registered nurses, certified nursing assistants, and all the other support staff that might go into running a hospital, human resources, management, food preparation and serving, cleaning, et cetera. That would describe the different set of occupations that go into successfully running a hospital. Whereas the data that we classify job and wages by industry, the industry is really focused on the primary economic activity of the employer. So in our data, our job and wage data by industry, this pertains to all employers that are covered by Maine's unemployment insurance system. Every quarter, employers that are covered by the state unemployment insurance system report job and wage information to the Department of Labor. And at the Center for Workforce Research and Information, what we do is we classify every employer into an industry, and we classify them based on their location throughout the state. An industry, broadly speaking, consists of a group of employer locations that are primarily established in either providing the same service or the same set of services, or producing or distributing the same or a similar set of products. And the industry classifications that we use, again, this is a national standard, but it's actually broader than that. It's the North American Industry Classification System. So we classify all employers according to their industry, and from there, we survey employers to collect the different job titles that are a part of that organization, that are occupational data. It's kind of a broad overview of the two big data sets that are the most pertinent here. So next, turning to a couple of questions around how often are these data collected, and are these data available at different sub-state and regional levels? And first, looking at our occupational data, we collect job and wage data via survey, as I mentioned in our occupational employment and wage statistics program, throughout the year. Specifically, we conduct 2 survey panels per year, and each survey panel represents a sample of Maine employers that are drawn into this survey to receive the survey form. And the survey panel would then consist of some follow-up, maybe email or phone outreach to try to collect additional survey responses from employers. The data in our occupational data set are available statewide. They're available by county. They're available by metropolitan statistical area, and they're available by workforce investment region, which is a collection of counties. There are 3 workforce investment regions in the state: the coastal counties region, central western region, and the northeast region. The geographic information in this data are based on the location of the job itself or based on the location of the employer. And we produce new estimates once per year. These estimates typically come out in April. So our 2022 occupational employment and wage statistics will become available within the next couple of weeks or so in April 2023. And we collect surveys throughout the year, update those estimates once per year. And now turning to our industry data, as I already noted, employers report to the Department of Labor quarterly job and wage information. And so our employment and wage estimates by industry are available quarterly rather than once per year. And we're also able to provide the data at a much more granular geographic level in our industry data set, because we are talking about actually the universe of job information as opposed to information that we're collecting via subsequent surveys that are sent when it comes to occupational data. So the data are available actually down to the city and town level, in addition to the other geographic building blocks that I mentioned in the occupational employment and wage statistics data. Generally, these data, we're collecting them every quarter, and the data become available about 4 or 5 months after the reference quarter closes. As well, we produce a more timely, updated monthly data set, which is based on a sample of those employers, but they're not available at the same kind of level of very granular geographic or industry detail. Let me pause there and see if there are any questions or if I should proceed.
Are there any questions for Mark?
Okay, so first we'll take a look at the available occupational data. I believe that there are 3 occupations in the occupational coding structure that are the most relevant to the Essential Support Workforce Advisory Committee. And these occupations are home health and personal care aides, nursing assistants, and social and human service assistants. But the most relevant occupation certainly would be home health and personal care aides. And in this slide deck, and I'd be more than happy as well to share with each of you in an email follow-up, we compiled the most recently available occupational employment statistics, which at the moment would be our 2021 data, as well as our 10-year job outlook for each of the relevant occupations. So starting first with our 2021 estimates, this would be an estimate of, on the first column, the total number of jobs in that occupation throughout the state. And as well, we've provided some of the wage estimates. So we have a range of different wage estimates that we are able to provide, but these tend to be the wage estimates that are most pertinent when folks are looking at these data. I provided the mean wage for each occupation, the entry-level wage for somebody starting off in that occupation, as well as the experience wage, which would be among workers that have some years of experience working within that occupation.
Mark, sorry to interrupt you, but Catherine has her hand raised. I'm wondering if she can ask a question.
Please go ahead.
Yeah, or when you're done with the slide, if you're done with your thoughts, maybe you'll answer it, but I can ask it now. So nursing assistant, I get that. It's a CNA, right? Certified nursing assistant. What gets classified as a home health aide? What gets classified from a credentialing perspective? So we have PSSs, MHRTs, direct support professionals, which is one that I'm particularly interested in. What would they be classified? How does the state handle each and every credentialed or certified job in this? Does that make sense?
Yes, so
Okay.
I believe many of those that you just mentioned would be categorized in home health and personal care aides. As a helpful kind of reference, I've provided here in the appendix section. These are a list of occupational titles, that are typically matched and mapped into this occupation, as well as a more detailed description. So some of these titles may not be as relevant in Maine, but personal support worker, direct support worker, personal care aide. These are some pretty common titles. So I believe many that you mentioned would be mapped into this occupation, home health, and personal care aide as well. If you had any other job titles that you wanted to run by our team, I would be more than happy, to send those job titles over to our team to say, how would these job titles be coded in our data?
Yeah.
That would be super helpful, Mark, actually.
Yep.
So we might need your email. Go
Sure
ahead.
thing.
Go ahead, Catherine.
No, I was just gonna say, let's make a note to be sure that as a group, we can collectively come up with a list.
And Betsy, you had a question too?
I did, but this kind of answers it, that social and human service assistants, I've never heard of that terminology. And I'm not sure how relevant that is in Maine.
Certainly, I agree. And the employment is much smaller relative to, turning back here to the statewide, went too far, to the statewide estimates. It's a much smaller occupation and is not as relevant. But in this instance, we kind of erred on the side of probably helpful to provide more information rather than less, even if it is not as relevant.
Well, and I'm curious, actually, Betsy, because I was thinking, so care coordination, and we have less here in this state than other states have a lot of care coordination going on. What do you think that would fit sort of in that social and human services assistant? In other words,
No, I think they're a higher level. Those are people with 4-year degrees who are doing actual social work. And I think where I think this falls is like we have what we call member services, which is I call it the administrative arm of care coordination, which handles a lot of the paperwork and that kind of stuff at the request of the care coordinator. So it feels like that might be more of that kind of like in the medical field, you have medical assistants. It feels kind of like that a little bit to me.
Sorry to disrupt you, Mark. Any other questions before we move on from here? Thank you.
No worries about the disruption. Please continue the conversation as anything else arises. But I will continue on. I mentioned these data are available at different geographic building blocks. So here are, for example, the same set of occupations that I just described, but the statewide data are broken down by county. So this is, of course, helpful to figure out the location and the distribution of those jobs in those occupations across the state. And I think generally, many of these jobs, or the distribution of these jobs across the state, does tend to follow along with the distribution of the population throughout the states. Of course, the largest pockets of employment in these occupations would be generally where you'd find the bulk of the state population, with the largest groups of employment being centered around areas where there is a lot of economic activity, particularly in the provision of care in Cumberland County, York County, Penobscot County. Again, we can provide these data at the metropolitan statistical area as well, to look at jobs that are specifically located in cities or at different geographic levels. And then, so turning next now to the available industry employment and wage data. We identified 8 industries, and I've listed them here, that we believe are the most relevant to the Essential Workforce Advisory Committee. These industries are home health care services, nursing care facilities, residential, intellectual and development, mental disability facilities, services for elderly persons with disabilities, residential mental health and substance abuse facilities, continuing care retirement facilities, communities, excuse me, assisted living facilities for the elderly and vocational rehab services. Now, we do have, as I mentioned, we have generally better, higher quality data that are available with much more precision and down to the city town level when it comes to job and wage data by industry, though industry data are not as helpful given that the job and wage data by industry would be inclusive of all occupations that you would find at a particular employer that would be in one of these relevant industries. So to provide one example, if you look at employers in home health care services, it's generally the case that when we're looking at this data, the majority of, or the largest single group of workers in home healthcare services do tend to be healthcare support workers. They tend to comprise the largest occupational employment, but of course, there are lots of other types of jobs that are connected to home healthcare services. And so when we look at the industry data, that would be inclusive of other jobs that may not be relevant here to the Essential Workforce Advisory Committee, including employment among registered nurses or healthcare practitioners, workers in management, HR, administrative, et cetera. So just always something to keep in mind when we do look at the industry data, it would be inclusive of all workers generally, though we can try to look at a more granular level by looking at jobs within specific wage categories to try to narrow in the focus.
Can you go back one sorry to so you have residential mental health and substance abuse facilities. Is there a corresponding behavioral health or mental health community provider classification? I'm just curious.
So let me again go to
this same goes for IDD services.
Intellectual disabilities.
Yeah, this is the industry mapping, which would provide, again, a description and sometimes examples of the types of employer establishments. And so for behavioral health specifically, might be something that maybe we should follow up after this, and we could take a look together. Just to make sure, see if there's something that we might have overlooked in the industry coding.
Well, and it's the same for, as Catherine just said, for the intellectual developmental disabilities. You've got residential, but not community. So those people who are living independently but have workers that support them on a day-to-day basis, that would not be residential.
Mm-hmm.
Just so I understand, this is, so each company, each business gets put into an industry, right?
Correct.
So say you're a company that provides residential supports, community supports, supporting people in their home, sort of all different. You provide supports for people with mental health, right? Supports for people with intellectual and developmental disability, the elderly. The business or your office, somebody picks one industry and puts them in that pot.
That's correct.
Okay.
Yes, we are tasked with determining the primary economic activity of that employer and the industry code that aligns most closely with the primary economic activity of the employer.
Okay, so that comes under you guys kind of based on all that data, that quarterly unemployment data, okay.
Correct, yes. A lot of the information does come from the registration of new employer accounts. So you'll have to provide, as a new employer, you would provide information to the Department of Labor about the focus purview of your business, as well as there are some supplemental surveys that we would send out if we don't feel, in cases that there's not enough information about the activity of that employer.
So Mark, just a quick question. If an employer fits into multiple categories, how are you determining the primary? Is it based on revenue or wages paid by that employer?
Yes, it is. It would be the majority of the economic activity. So yes, it could be. generally it would be based on revenue or the labor inputs. Yes.
Okay, thank you.
And these industry titles, these are titles that are used nationally or
Yes.
because we don't use the word elderly anymore, and I just wonder where that, I mean, that's just something that the federal government gives you and you have to use it?
Yes. Yep. The actual, these are certainly not titles that we in Maine or I specifically picked. None of these words are words that I or anybody in my office chose. We're just referencing the documents that are provided to us by the Office of Budget and Management in collaboration with the Census Bureau and the Bureau of Labor Statistics to
I
standardize
thought
this
as much,
system.
but thought I'd ask.
Mhm. So, okay. Unless, were there any other questions about industry employment concepts? Okay. So next, I've highlighted this question on the agenda around, we've talked a bit about how often the data are collected and how often new data are reported, but around this other aspect of how often we should be checking for progress. So one of the unfortunate limitations of the Occupational Employment and Wage Statistics Program is that it is not designed to assess whether jobs in one particular occupation are going up or down from one year to the next. So because of the nature of the survey program that I described, survey panels are collected throughout the year, and there are multiple different survey panels. And so because those surveys are being collected over many months, this doesn't necessarily provide us with a statistically valid comparison of how many jobs there are in one year relative to the next and whether or not jobs are going up or down. So generally speaking, because we get much more granular and higher quality information in our industry data, generally industry data are much better suited to assess jobs. And so I've compiled the overall staffing levels in those 8 industries that I just described in these next 2 slides. And this is just a bit of an overview about what's happened in terms of the overall staffing levels throughout the pandemic and the period just leading up to the pandemic. So it's generally the case in those 8 industries identified that the overall staffing levels have declined at the onset of the pandemic, and they are noticeably lower as of the end of the second quarter of 2022. The decline in staffing has been most notable in skilled nursing care facilities, which is the largest of the direct support industries from the identification slide just before, where staffing levels were a little below 10,000, about 9,650. Before the pandemic, they have fallen to about 8,150 in the most recent data. And then the next slide, just the other 4, generally the kind of smaller 4 among those direct support industries. Again, overall staffing levels are lower. If you added up the staffing levels across all 8 of those sectors, there are about 4,400 fewer jobs across the 8 industries relative to just before the pandemic. And we have seen generally, though modestly lower staffing levels in these other 4 generally smaller industries.
So Mark, are these numbers reflective of the number of opportunities in these certain industries or the number of workers based on a point in time to the next point in time?
This would be how many jobs, that is, how many workers that are currently on the payroll of the employer that are reporting to the Department of Labor. So these would be jobs that are currently filled. This would not be representative of vacant or advertised positions. These would be filled jobs that are actively part of an employer's payroll at the time that they reported their quarterly employment and wages to the Department of Labor.
Okay, thank you.
Mark, this is Dan. I got a really quick question. How does this compare to the other healthcare opportunities that aren't in your categorization here as it relates to growth or decline?
So broadly speaking, across the entire healthcare and social assistance sector, that would be inclusive, of course, not just of these direct support industries, but would also be inclusive of hospitals and ambulatory care, offices of physicians and dentists, et cetera, medical testing, as well as childcare. Staffing levels, for the most part, have recovered, though they are modestly lower compared to just before the pandemic. This has generally been an area where we have seen a huge increase in jobs over many decades. Going back to 1990, for example, there are about twice as many jobs in Maine today in healthcare and social assistance as there were in 1990. So broadly speaking, this has been an area of massive growth in employer payrolls. But in the pandemic period, we have seen, of course, a dramatic disruption, pretty significant job losses in healthcare and social assistance at the onset of the pandemic for a variety of different reasons. Most industries within that sector have recovered to staffing levels that are pretty similar or even above just before the pandemic. But in these 8 direct support industries, again, staffing levels are lower, haven't quite recovered to the pre-pandemic staffing levels that we saw.
Great,
Mark.
thank you.
Thanks, Ian. Mark, would you be able to provide this data for a decade? And I asked that because we really started seeing the significant wait lists for programs and starting to see significant declines in staffing in nursing homes around about 2014, long before the pandemic. And so I'm really curious to see if this is sort of a longer term downward trajectory that has little to do with COVID.
To answer the question, yes, we can provide the data back
Purely
over the course of a decade. Yes.
Yeah.
And Mark, in the data that you collect, there's nothing that speaks to the causality. There's no explanation as to why the decrease in these specific categories. Like employers aren't reporting that into you, staff retiring, whatever the case may be, moving on to different jobs outside of the industry.
No, that is correct. If there is a reduction in employment, that there would not necessarily be a reason that we could, so the layoffs would be reported to us, given that somebody is laid off through no fault of their own and files a claim for unemployment insurance. But other than that, like somebody just retiring or leaving a job or switching industries, that kind of thing. No, there wouldn't be any reporting to the Department of Labor that would be required. So no, we can't really speak to that per se.
Yeah, I was thinking, I had a similar thought as Dawn, thinking about, is any of the, we always hear all the time that people leave Maine, all the young people are leaving Maine. That's why we don't have any workers. And, I think it's a factor. I don't think it is the only factor, but do these ever get charted with like number of people in the workforce, or, if there was a decline in the workforce in general, or a decline in working, what quote unquote, what we used to call working age people, or, is there any kind of like parallel data that could like sort of mirror any of this?
Absolutely, yeah, and we have lots of that data. It's not necessarily what I had provided today, but I think generally the largest factor underlying the workforce constraints in Maine is just the demographics, the aging population structure. Over many years in Maine, birth rates have tended to lower, and the population structure has become more and more imbalanced, with more people reaching ages where participation in the workforce is lower relative to the number of young people in the state that are aging in and reaching those age ranges where participation in the workforce is highest. So generally, I think that's the largest source of constraints in the workforce is just the population structure. And I'm not sure how much mobility per se, like young people leaving the workforce is directly attributable to that, or if it's just generally about the demographics where, birth rates have fallen pretty consistently over many decades. Just relatively smaller number of younger people aging into prime working ages in the state.
I have a question. So the word jobs, is that bodies employed, or is that FTEs, or is there anything, or is there anything that defines that job word?
Yes, a job would just be defined as a person that is an active part of an employer's payroll, no matter how many hours that person works, whether working part-time or full-time. That job would be reported to the Department of Labor. So we're not adjusting, say, based on shifts or hours worked or anything like that. This would just be how many jobs employers are reporting to us. So it certainly could be the case as well that some people do hold multiple jobs. So it's not necessarily the count of the number of unique individual workers, but the number of jobs, because there is, to some extent, multiple job holding where some people would hold multiple jobs. Some in these data right here, some people might have 2 jobs or more within these set of industries, or
Absolutely.
you can imagine as well somebody who works in one of the support industries, but also has another job, perhaps in a retail environment, something like that.
To follow up on the question, so what about a per diem worker?
If that particular job is covered by the state's unemployment insurance system, yeah, I'm not exactly certain about the technicalities of each type of position, how or why it may or may not be covered. But if it's covered and the person's wages are covered, then I think it would be included in our data.
Thank you.
Okay. And then just one other quick note is there were questions on the agenda about the different payers that are so important in healthcare. The data, though, at the Department of Labor, we're not collecting, as we're collecting job and wage information. We're not collecting any information about payers. And so in our data, we would be providing job and wage data that would be representative of all payers across Maine Care, Medicare, private insurance, et cetera. So we are not able to break down any of the data that I just showed you all by the different payers and the relative responsibility of different payers in the system. We are able to, in our job and wage data by industry, we are able to distinguish between different ownership types, but this would be useful if you were interested in better understanding, say, state-run facilities versus private or not-for-profit facilities, not necessarily the payer when it comes to the provision of the care itself. But we do have the ownership type of the organization, whether it's a private or not-for-profit, in the private or not-for-profit sector, state government, local government, or federal government. Yeah. Pause there if there are any more questions.
I have a question. So in general, how within state government, how is this data used? Like, what is it that you do with the data on a routine basis?
That's a great question. Well, our data, of course, would span all industry sectors and all occupations, right? So some of what we do is try to provide data that is really specific, whether it's to a group of policymakers or a committee such as this one, an industry organization, anybody that's interested in a particular subset of the economy. We certainly provide as much as possible specific data to help people answer their questions. We provide data to job seekers that are interested in exploring different careers that are available to them. We provide information to employers that are better or trying to better understand how to set a competitive wage, given their local labor market. And we provide general information just about, overall statewide working conditions, like the state's unemployment rate, the state's job report, which would be, across all sectors. We have a range of different, customers that we try to serve.
So now I'm going to ask a data mining question. So understanding that, so all employers are reporting quarterly. So presumably, right, all nursing homes in Maine are quarterly reporting to you all certain data. Is that data available by worker type, or are they just giving you, this many jobs and this much money spent or on salaries? Just trying to understand, like, what does that look like? In other words, is that something even though it's not reported, is it something that could be reported? Just trying to understand what data could be mined.
Yep. So on quarterly reports, and I agree that probably generally speaking, every employer in, every nursing home, for example, would be reporting every quarter how many staff they employ and the wages that were earned by each person on their staff. But as part of that quarterly tax report, employers are not obligated to report job titles. So this essentially would just be information about the people that are employed and how much they earned. So we actually do not, in those quarterly tax reports, there's no requirement, and we don't collect the job titles that are associated. For example, a direct support worker versus a registered nurse. So those data elements are not available to us. We can kind of, maybe make assumptions about wage ranges to isolate, which workers are in different occupations. But that's why we have a separate survey program, or occupational employment and wage statistics, where when employers do get sampled in the occupational employment and wage statistics program, we're requesting essentially the job titles that exist at that organization, how many staff you have in each of those job titles, how many direct support workers, how many registered nurses, et cetera, and then the wage ranges that are paid to staff in those positions.
The other questions from Mark. I've got a question for Abby on this particular general question.
Just a comment. I think if people are trying to extrapolate what kind of worker somebody is based on a job title, that's probably not a very accurate way to figure that out, because some of the job titles are not reflective at all of the work that the people are doing. So I mean, it just feels like this is a giant ball of yarn. And when you start tugging on it and it starts to unravel, it's like, oh my God, where's it going next, right?
Well, I should say that the job title is a really important source of information for our staff, but there's a lot more information that we do use when we try to specifically code every job at an organization. We collect job titles, but we might have follow-up questions. We might, call an employer or email an employer with follow-up questions, but we also conduct some pretty thorough research, and we might ask the employer about the nature of their business, what types of functions exist in the organization, even doing research like on, LinkedIn to better understand the credentials of people, things like that. So there's a lot that goes into it, but I'm trying to provide a pretty, succinct and straightforward overview of these data programs. But you're absolutely right. It is very complex, and that's why we have a team that really work on this throughout the year, collecting this information and trying to do their due diligence to really make sure that we get it right to the best that we can.
I have a question, just I guess more like an opinion question maybe, or, I saw that there were 3, those are standard occupational codes that you're using for the job classifications. And do you think it would be helpful to have sort of that be, like Betsy was saying, like that be more specific to industries? Like, would it be better to have more? I know that's not, I mean, I know it's the Bureau of Labor Statistics that have to do that, but I think that that's been a challenge, just speaking from IDD services, is that the workers in that sector do a large big diversity of jobs or tasks within their profession, and it feels like that's not captured very well anywhere. So I just thought, you know, just sort of in your experience in working with this, what are your thoughts in general on what's available for buckets to put workers into?
Well, so again, this is a coding structure that really has to try to capture, you know, the entire economy, every single sector. So, you know, in almost any area, anything that you're hoping to learn using these data, I think you're going to find some, you know, some strengths and some weaknesses. The advantage of having big groups of workers that have similar functions is that the data quality are going to be much better. You know, to the extent that you have more information about workers, you're going to have higher quality data. So you do run into a trade-off where, you know, if you broke every occupation in half, or if you broke every occupation into 4 specialized occupations, the more and more and more and more you break up the different coding structures, the less reliable the information that you're going to get, because it's just going to be based on less and less and less information that you're putting into the model. But yeah, certainly to the extent that, you know, the work here is being limited by, you know, a larger occupation that is losing out on some of the variations in terms of the different things that the different types of, you know, jobs that people are working in and what they do in their day-to-day work. That's certainly a limitation of the coding structure. Yes.
Thanks.
So I was the first one to do it, to talk while muted. So what I'm hearing, Mark, generally is, you know, we're using both a national and continental data platform, and it is what it is. And to fix that, we would be having to fix it at the national or continental level, presumably. And so I think it sounds to me, and I'm you know, sort of a question, but not, it sounds to me like if we really want to dig deep on the number of actual workers who are working in this broadly defined workforce, we'll have to find a different way other than the ways you traditionally are using, because we can't get down to the next level that Catherine's talking about.
Right. So there are procedures in place to, as these structures are revised, generally each of the structures is revised on I believe every 4 years. So that's certainly the possibility, to the extent that the coding structure is limited. You know, the ability to, you know, glean meaningful information from these programs, then that's certainly an avenue to provide feedback. And I believe that would be to the Office of Budget and Management around the limitations and possible improvements. But yes, that would be a decision that I believe is made federally. It's not something that we necessarily have autonomy over here in Maine in terms of changing the coding structure.
Yeah, that's what I was figuring. Great. Well, I'm going to ask one more question, because it's just, you know, I moved to solutions probably quicker than I should. I mean, has the Department of Labor or Bureau of Labor Statistics ever done a project around a particular workforce where it's collected data in a different way outside of those systems?
Yes, we have. So we certainly have, over the years, we have collected data for various reasons that that are specific to a workforce or a sector, or particular set of occupations, et cetera. Yes, we have done that. It certainly is possible. Something about it, though, that is challenging is that we are not able to use this federal state infrastructure that we have in place to pursue those other avenues. So, for example, we can't just piggyback off of the Occupational Employment and Wage Statistics Survey and say, let's use all of the technical expertise, the survey forms, let's just adapt it to our needs. It typically would require creating a survey program from the ground up, rather than saying, let's utilize all the data and the resources that we have, because we are very fortunate to have federal funding to create these programs, but that does mean that we have to, again, kind of comply with the federal standard. So going that direction would generally require creating a new program with a new set of funding, new staff, that kind of thing.
Absolutely. I figured that was the answer. I was just curious if there was sort of precedent for doing something like that. So, other questions for Mark? And I think you're going to stick around because you've got another slide for another part of the conversation later. Is that accurate, Mark?
I'm more than happy to stick around. I'm not sure. I think that was really the bulk of what I had prepared, but as other parts of the conversation, maybe I could speak to, I'm more than happy to stick around.
We're happy to have you. You're a very useful person.
Thank you.
Abby, I have a question for you if you're there and not freezing in your car.
I am here.
I have to say, I've done this so many times. I'm sorry that you're in this situation. So, so as part of the enhanced FMAP funding, the department through OADS put out a significant amount of money for sign-on and bonuses for direct care workers, community home and community-based service workers. And I know just Paul mentioned numerous times as a part of that, basically employers, providers were required to complete some basic information as part of that. Can you share, I don't know if you can share, I mean, I know you're in your car, off the top of your head, if that data exists somewhere in writing, if it's data that could be shared?
I can definitely share a status update on that for sure. So as part of those recruitment and retention bonus payments that came out of the FMAP funds, we did, as a department, request additional information from the providers issuing those funds. And as far as I know, the current status of that data is that it is still being worked on to make sure that folks are comparing apples to apples. There are some questions with the forms, but we're very excited to get that data in shape where we can share it. I've seen preliminary stuff that was not fully reported. Some providers were having issues and questions, and that, I believe, is where we are with that data. I can provide an update to the committee more formally via email, but that off the top of my head is where I know that data is. Paul and everyone else at OADS, I think, is pretty keen to share it once it's ready, but I don't think that we have it compiled in a way yet where we can share it.
Great. And just to be really clear, that, because I'm trying to clarify, so that those are only providers of home and community-based services, correct? Not nursing homes, assisted living facilities, PNIs.
I believe those are just home and community-based service providers. So the folks who are eligible for the recruitment and retention payments, anybody who received that money, and off the top of my head, I don't want to make promises. I mean, if a nursing home somehow received it in line with the needed regulations to receive it for a PSS or something like that, they may fall into those categories, but I'm not certain off the top of my head.
Gotcha. And those providers are only providers that are taking Maine Care, I'm assuming, because it's FMAP money. Yeah.
Yeah, so the providers, as far as I understand, would be anyone who qualified for those payments. So if their workers received those payments, they would have had to provide us with the information.
Okay. Any other, because we at the last meeting really sort of talked about wanting to dig down on this issue of trying to understand the number of workers currently working in this workforce, and ultimately the number of jobs that are available that we need workers to fill, so that we understand how many workers there are, just to understand this conversation, right? How many workers there are, and how many workers we need to add to be able to meet demand, depending on whether we're talking Maine Care demand or everybody who needs support in Maine, and then be able to track over time whether we're making progress. So I'm hearing so far that we don't really have any concrete way yet to identify the number of workers working in this industry, is unless anybody else has other ideas around how we might be able to quantify this. So I'm just gonna now just open it up for conversation in terms of this particular piece. What are folks thinking about the need for this data and where we want to go from here?
So Jess, if I could just summarize what I think I heard, and Mark, it's always good to have you present and share the information. It's so valuable. So what I'm hearing is there's been a decline, or there hasn't been a recovery of jobs since the pandemic. And the other healthcare sectors have seen a rise back up to pre-pandemic levels. Now that may be give or take a few here or there. But there's definitely, obviously, a lack of folks. And I hope when we continue through our work, we're going to come up with recommendations that drill into how do we create more of these opportunities? What are the policies that need to be put in place? What are the incentives that are currently working or not? And how do we raise wages? And I know that means that's a complicated piece because of reimbursements and whatever, but I'm concerned in listening to the information that, you know, there's obviously been increased wages across the board, and is this keeping pace? And if it's obviously not, what are the strategies we'll put in place, and how do we find the individuals who we need in this area? And the other thing I would say is this is a global problem. This is not just a Maine problem. This is a workforce problem all around the world. And I'm also convinced, and I can be argued on this one, that if we even get into a slowdown, or one we'll call the big R word, we're still going to have a huge demand as Maine's aging. So I'm curious about the strategies and how we increase and amplify these positions.
And Dan, on top of that, I think, you know, there's been a lot of wage adjustments for this population over the last 3 years, I guess I would say, with reimbursement rates being changed. And, you know, I'm curious, like, has that had any impact on attracting more people to the workforce? I'm not sure that throwing dollars at wages it'll always be a dissatisfier, wages. So, but the other thing that we need to take into consideration at some point, and it may be beyond the scope of this committee, is the wage compression that many of us are seeing inside our organizations, as the bottom is getting attention, as it should, in terms of those low wage jobs need to get better wages. It is compressing up against the wages that are not getting additional resources. And that's also then exacerbating another problem.
Not to mention, this is hard work. This is hard.
Hard, but gratifying work for people who love the work. Tom.
Just want to underscore Betsy's comments. I think it's terrific that we've seen the wage increases that we have. The competition wasn't national labor statistics. It was McDonald's, Burger King, Starbucks, and Cumberland Farms that were all beating direct care workers. But as we do that, I'm reminded of all the other issues that we discovered 2.5 years ago when we had that task force commission, and simply resurrecting that and staying on top of it. But I think with wages, not only do we have the compression problem that Betsy mentioned, but it may be that we've caught up, for this snapshot in time. But if we don't make this a regular process, it's working right now for the 90-day window here, but we just have to stay on top of that. So I think that we can't rest on laurels, but we also can't ignore all the other components, and there were many, and that was a wonderful report. I think this group can bring that back to focus. This is a legislative advisory committee, right? So this would be where I bring that back, and that work's already been done. So nobody in this needs to hear me blather that. We've already done that work, and a lot of fine people contributing to that.
I think, I wonder, we have the occupation data, right? That's already being collected and reported on. But and it is not perfect, right? It is bodies, and that's what it is. Sorry. And now I'm train of thought. But I just wonder whether there is a benefit of utilizing that data as a measurement point. I think where we're missing is how many workers we need, like something to compare it against, right? We see we've lost 4,400 jobs over the course of the pandemic, and so we need to we know that there's that many we need to gain back, right? In theory, because that would just get us back to the abysmal place we were from a workforce perspective prior to the pandemic, and maybe that's enough to work towards, or is there anywhere within within any data points that says how many workers we need, and also just sort of that concept of, does it make sense to use the data of the workers we have, even though it's not perfect, to be a measurement point?
And I see your hand raised, Betsy. I'm just going to ask Mark a question. The data that you shared on those 3 codes and your willingness to hear from others about, sort of where a particular worker fits in. I'm wondering, based on what Catherine was just saying in one of the, sort of these things, is if we can identify, right, where each worker type that we're talking about is going into one of those codes. And then we could look at those codes over time, right? The 3 occupational codes you shared. Once we sort of feel good as a group that the code, that the kinds of workers we're talking about are in those 3 codes and not some other code randomly, right? And if they are in some other code, then so I think what I'm hearing Catherine say is, even though it's not ideal, we could look at those numbers because we're going to keep reporting that in the same way as a state over time, right? If we're making sure that all of the same worker is going into those categories, and we look at those categories as the baseline, then that's one way we could look and say there was growth or there wasn't growth. Is that what I'm hearing you say, Catherine?
Yes.
Okay. And Mark, that's something we could do as an action point.
Yeah, it certainly is. It's really challenging to try to answer a question like how many workers do we need? It's a very dynamic environment where, there's been a lot that has changed. There have been, some organizations that have closed, or maybe some that have opened up, or some, mergers, for example, or things like that, that fundamentally changed the landscape. So it's difficult to assess, as well. There's this constant movement in the labor market that's happening. So, it's difficult to pin down. I mean, certainly we can try to help.
Well, I'd encourage you to take a big step away from this question about what do we need. I'm really stuck on the what do we have first. That's all. I mean, I feel like we don't even know what we need if we don't know what we have. Right? Because we don't have anything to measure against. And so what we've been trying to do is to say, how do we know anything we're doing is successful if we don't have a baseline? We need a baseline, and forget about GAP for right now, or what we call GAP, which is like people who aren't getting care. We're going to talk about that. That starts to drive the how many workers we need. What we're trying to do is figure out how many workers do we have right now? And what does that look like over time? Like the last 10 years, how once we figure out if the workers are in those codes, then we could really, and in those industries, we could really look at that and see the trends over some period of time. We can even see if those worker codes grew in the last year and a half as we've been launching all these initiatives. And is that fair to say?
I think it is fair to say, and we can certainly try to provide the data from different points in time to say, how has this changed over time? Absolutely. But again, the data by industry are much better able to answer those questions as opposed to the occupational employment survey, because as I mentioned, it just isn't designed to be a year-over-year comparison for, are there more jobs in this occupation or fewer jobs in this occupation than a year ago? So we can certainly provide some, I think some high quality baseline data, but it would be based more on the industry perspective and not the occupational perspective.
And that's a little harder to get to who's getting put where.
Mm-hmm.
Right? That's a little bit.
Yeah,
we could say to you, Mark, where are you putting PSSs, right? Personals, or DSPs, I don't know what those are called, drug support professionals. What occupation are they getting classified as opposed to like looking at the entire in the like overarching industry of care and where are each provider or provider type, or so it's almost like you have to look at that number in total. So those 8 industries, right? What does that number look like in total? If I'm just trying to,
yeah. It's apples to oranges though, is what we're talking about. I mean, because the industry includes everybody, the CEO, the psychiatrists or the doctors, and the nurses versus the DSP. And they don't have the data on those job categories, and the other one is a survey. I'm getting what you're saying, Mark. It's not ideal. So I think we'll have to keep noodling on what to do here. Betsy?
I have a couple of questions about this workforce. I know so many in this workforce are not full-time. And so what's a worker? I guess, how are you counting these bodies? If we're trying to count people in the workforce, are we counting people who work any hours at all, or are we counting full-time equivalents? And so that's one question that's noodling around in my head. The other one which flips to the other side, which is what do we need? it feels like there should be a way for us who are in these different subsegments of this industry to be able to say, on average, a person needs X hours of care. And, if we could get an hour, I know everybody's care plans are different and all that, but, on average, a person who is an IDD living independently needs X number of staff people to help them. I have a nephew, so I know how many staff he has, and it's multiple, and he's one person, right? But you got someone living in a group home, it might be a different ratio, or you got somebody who's getting care in their home that they may need one full-time equivalent. So I think there may be ways to sort of get to the need or the gap fill. And then the other thing is, every time the clock is ticking on, the number of people that need the assistance is continuing to grow, especially when we're talking about older people in Maine. So that population is increasing. So it's not like what we had 5 years ago would fill the gap today. It won't, because the numbers have increased. So those are just some thoughts that kind of been floating around as we've been talking.
So I'm wondering if Tom Newman, please.
Okay, I didn't mean to interrupt Catherine, but following up as usual, Betsy Sawyer Mancher, who serves a lot of the same population we do. This is exactly where I'm going. I think just that there's only so much we can get from the hard statistics. Yes, it'd be nice to have it more timely. It sounds like for Mark, it's not going to be these stats. They're going to be the year over year. But anecdotally, we know we have understaffed hours. That's huge. I don't think we need more stats to know that. So what could this committee do? How about some creative approaches to untapped areas of potential labor pool? Again, probably won't show up in the statistics, and come up with some creative concepts for training. Number one, Catherine was tossing out all the initials. The one she knows at DSP, direct support worker, but the PSS, professional support specialist, there's personal care assistants. They're all doing pretty much the same thing. Didn't we say 3 years ago or 2 years ago, wouldn't it be good to have a universal training and qualification system? Let's resurrect that. I mean, that's still a good idea. We just haven't done it yet. This committee could maybe make that happen. Let me lower my hand here. And two, the immigrant legal advocacy project. They're always looking for volunteers. There's a huge population of new Mainers. You saw even our own Susan Collins trying to pitch for getting work permits earlier. Right now, you have to wait 6 months after arrival. No, 6 months after applying for asylum. Well, on the state level, what could we do? Is there training? We need translators and interpreters to help them. They can get to work. At least they can work, in the actual legitimate workforce rather than underground, which apparently they do. And bring them into the workforce. Next, for people who haven't sustained a disability, 80 is the new 65. There's a lot of people who would work. And if they knew this is really rewarding work, as you pointed out, as long as they don't need a 400-pound lift, people over 65 can do this work and would be good at it. And there's another untapped labor. It's not going to show up in the statistics. So those are areas which I know we've talked about before, and I don't think they're necessarily ones that we can derive from current or old statistics, but we know anecdotally those are things that would suit the Maine population. So maybe this legislative committee can focus that in a way that could actually propose some concrete action. It would take funding for the training, to get the across the board licensing and or certifications using that licensing. And we need support and money for translation interpreters to help the new Mainer workforce. So those aren't new thoughts, but I do think we could resurrect those ideas.
Jess, would you mind if I talk a little bit about the efforts that we are working on those particular initiatives?
Yeah, can you hang on for one more second, Abby?
Of course.
Because the answer is absolutely yes, and we're coming to you on many different ways. And just remind, I dropped in the chat the authorization, the statutory language in relation to this. And a big part of the work that we're trying to do, Tom, is to understand what's already happening before we jump to the let's do something. Like we
Got it.
really have to, we heard at our last meeting what's happening. We were going to hear again what's happening. So Abby's going to offer those updates.
Right.
Mark was here to talk about data because one of our requirements is to monitor whether all of these things both the departments of Health and Human Services, Department of Labor, we should say over and over again, are doing great job. They're working really hard to actually operationalize many of the recommendations in the commission's report.
So this would be
What
a way
we're
to measure.
trying to do is to say, are any of them being as effective as we need them to be, or do
I
we
see.
need to do more? Okay, so let's not jump to, we're not the action group because the commission's report is the action group. I mean, is the roadmap, and DOL and DHHS are doing a lot of those actions. And then we do want to say, you know, where's their recommendation nobody's working on. But we want to understand is what's happening being effective. They've launched, you know, this incredible website. DOL has done all these incredible, like very specific, you know, job fairs for these workers. They've gotten hundreds of thousands of hits on the website. What's happening? Does that translate into people coming into the industry and staying in the industry? We need to know that, and we don't
Yes,
have.
that makes sense. I'll
Okay,
need to
great.
catch up on that. That makes a lot of sense.
Great. Terrific. Catherine.
Well, I'm gonna go back a little bit. You know, I don't know if it's in every industry, but you know, we do put every individual sort of in our service sector has a number of authorized units that are authorized through, you know, KEPRO. And so, you know, that should be able to be collected and say, you know, this service collectively as a state has 2 million units authorized for it. And I wonder if that's a way. It's not going to be, again, perfect because it is this apples and oranges things, but I wonder if there is way or are ways to collect some data on what the need is based on those Maine Care authorization processes. And then I think this is what Abby's going to talk to, but I'm not 100% sure. But at the last meeting, this is totally separate thought or question. There were several, you know, there are several reporting outs that were going to be done at the beginning of the year, and I saw the quadruple A one. I didn't know if there were other ones, and are we going to get a report out on the report outs, or are we just sort of wondering as a group how that process is gonna go as time goes on?
And I think that's exactly where we're going. So we were trying to look at the data piece first, and I think Abby, we're going to turn to you, but we've had a request for a brief break, which I think is really not a bad idea in a 3-hour meeting. So I wonder if you all would agree to take just a brief 5-minute break to stand up and refill your water glass, bio break, and then we'll come back at 2:30 and turn things over to Abby for updates, and then some question and answer. When you've come back, if you don't mind turning your video back on, that'd be great. All right, well, it's 2:30. So if you're back, if you wouldn't mind turning your video back on. Abby, are you still with us?
I am. It sounds so mysterious. Are you with us? We're in a seance here. I do apologize about the power outage. Maine was just throwing it at us yesterday.
It's your fault for sure that we had this big power outage thing happen. Yeah.
I moved to a beautiful area of Phippsburg, and that is my fault. And I will say that's on me.
Well, it's funny because I heard Phippsburg got it really bad, and then one of my friends who lives there said that she got the power back on before we did. So
that's crazy. There are like 2,300 people that live in Phippsburg, and 2,000 of us still don't have power. I've been checking CMP maps all day.
I know. Sorry. Yeah. Anyway, wow. And you're, oh, right. You're not sharing your screen, but Abby is going to take it from here. And so just as a reminder, we did have an agenda, and the first part of the agenda really was sort of what's the available worker data on workers. And now we're moving to the available data on gaps in services focused on consumers. But also I think Abby is going to also share some updates about what's happening. So I'm going to turn it over to you.
Thanks, Jess. Yes, so I want to address a couple of the updates that were mentioned just before we took our break. The first one is that the quadruple A report, so the second annual report in response to a previous committee's outline of suggestions, is out. It's available. It's on our website at OADS Initiatives, and I think there's a blog post that accompanied that when it came out. Links to that are in this PowerPoint, and if anyone needs them, we can send those out. The quadruple A report is really good because it talks to all of the various efforts that are going on with workforce across departments. So it's the Office of Aging and Disability Services, it's Maine Care, it's Division of Licensing and Certification. So lots of big updates in there that you can explore. I'm happy to give an update on that report separate to that report if that's something that folks want. I think the blog post goes through it. I can go through it at a different time, but lots of information in there. Happy to go through that more. One of the things that...
Do you mind just sort of hitting the top level points? It's a pretty big report, but I think the overall view, right, is from this is that we have stabilized, is I think the word that the sort of the workforce has been stabilized with all these efforts, but not necessarily grown generally.
Yeah, I think that's a fair top line assessment of the report. Sort of in a similar vein to what Mark was talking about, the effects of the pandemic, we've sort of overcome those. We've gotten back to a baseline that we had before COVID hit us. And now we have a lot more in the tank to go to grow this workforce. I'll speak to a couple of high level points that you were mentioned on this call. First of all, someone mentioned talking about a state system for credential tracking to really track our workers, to have a better pulse on things. And that is one of the initiatives that is happening. It's part of the 9817 funding, but it's also part of the state learning management system, RFP, and that proposal or that process is coming to an end. I believe they've selected a vendor and they're still working through the ins and outs of that process. But that state LMS system is something that we hope to use to also track all of our credentialed workers. So instead of having various databases across systems, we will have one learning management system, or LMS, which will be able to track all of our credentials across all of those systems. And you know, the technology around consolidating our technology is a step, so that'll take some time, but it is something that is planned and we're working on actively in line with other big state systems so that we can keep everyone on the same page. Another thing that we're doing is translation was mentioned, working on consolidating and then moving forward with translated training material for our new Mainers is another initiative that we're currently working on. You can find specific information on every 9817 work project. We update them every 6 months, and those updates are also on the website by project. So that curriculum consolidation project is another 9817 project that we're working on. 11 years ago, Maine received a HRSA grant to consolidate the DSP and PSS along with elements of the MERT 1 course. That work happened, the course was piloted, it went really well, and then support for it sort of dwindled and the work fell by the wayside. Since that time, national DSP credentialing, national DSP curriculum has come a lot further than it has along the aging services world. And so just pushing those two credentials together no longer works because the DSP is a bit heftier than the PSS right now. So we're working to consolidate the curriculum where we can so that job seekers and those already in the field don't have to redo credentials that they already have. But that the folks serving our IDD communities get more training that they need. And we're doing that along with national aging experts. We've spoken with Advancing States, Robin Stone, to align that core competencies course around the 2014 CMS core competencies work that's being done nationally, so that anything we develop will have sort of national boundaries around it, and we could help to track it. We spent a lot of time in our previous hour talking about how the data is not exactly what we'd like it to be to track this workforce. And that's something that I've spoken with national groups about, where they want to see the title DSP in some of these databases. And they also would like to see the title DSW, Direct Service Worker, or Direct Support Worker, in these databases as well. So everything that we're doing with curriculum and credentialing, any changes, we're trying to tilt them towards the national models that are evolving in these various states and groups to make sure that anything that Maine creates is best practice, best in the nation, and in line with what we're sort of doing nationally, so that our workers can move in and out of the state. We can recruit from other states and our workers, if they have to, we hope they don't, but if they have to, they can go to another state as well, easily, and with some of the best credentials that we can get. And then lastly, on this, and I do have all of these slides on what I'm supposed to be talking about, but all of this is really exciting, so I'll just keep going. For the older workers that Maine has as a population, we're very keen and aware that those folks may be interested in doing some meaningful, awesome work in this field. They've been a primary target in the marketing campaigns that we've done so far, hand in hand with DOL and some of the other workforce attraction groups that are working on marketing across the state. We have a couple more marketing dollars to go, and we're going to be targeting those older workers as well to see if we can get everyone in Maine just interested in this work, understanding its value and how it's vital for other Mainers to live independently and live great lives in Maine. That was a lot of talking. So I do want to pause here and see if there are any questions about all of the sort of FMAP stuff that I've talked about, the quadruple A report, and then we can dig into the slides. Unless, Jess, you'd prefer I just start talking through the slides and we could do questions at the end, however you prefer.
Go ahead.
Jess, you're muted.
Yeah, go ahead and do, why don't you just go through the slides? And then we will we'll pause for questions, and then we'll move to discussion.
Sounds good. So we've prepared a short presentation on the information we currently have available and a look at the information that we hope to have available in the coming months. Depending on the level of questions that this committee has, it might be appropriate to invite additional DHHS staff to present at this meeting. I'm going to take note of any questions and bring the ones that I can't answer back to the department, and we can respond in whatever way is most appropriate. So here on slide 2, the department currently publishes information on the OADS website about some of our programs and wait times. Quarterly information is published on participants, wait lists, and those with coverage on currently available, and was last updated in December, with the oldest available data from the quarter ending in September 2019. The images for this slide were taken directly from the website, just to give you a sense of what's already out there. Next slide. So the currently available data uses wait lists to measure unmet need. However, the Office of Aging and Disability Services is working to evolve this measure to get better data on unmet needs. So evolving beyond member counts, we're trying to determine who is waiting, how long they are waiting, and how many people are accessing services. This is the story we're trying to better understand now to evolve the numbers that we currently make available and make more numbers available to everyone. So some of the barriers to this work are the different data sources and different systems of care at play that make comparing apples to apples a little bit more difficult. The barriers are not insurmountable, but they just make comparisons between waiver programs more challenging, but still worth doing. Next slide. So historically, we've looked at how many people are waiting to receive services. We're now adding a look at how long people actually wait to receive those services. So for this slide, members who meet Section 21 Priority 1 criteria receive an immediate offer for services. What is on the screen are other priority levels, and this current information is on the website, again, taken directly from our website, as the department has been trying to publish data online when available. We'll dig into some of the other data we're working on in the following slides. Next slide. So OADS hopes to publish measures under development in regular reports starting in the summer of this year, 2023. The variables that we're exploring are the length of time on wait lists or for completed assessments, service utilization, service initiation wait time, service location, and the experience of the folks receiving care. Next slide. All right, you'll notice it has draft. These are preliminary measures still under development, but we wanted to share the most recent data that we had available to you, although this is hopefully not for publication. So this is an example of the data that we're working on for the Section 19 Aging and Physical Disability Waiver, looking at time from referral to completed level of care assessment. The data on the screen is the actual monthly breakdown of average business days from referral to assessed date, but this data is still being collected. The hope with better data collection like this is that OADS will be able to use the insights generated to pinpoint areas of the service process that need more attention and that need to be addressed. Next slide. Staying with the Section 19 Aging and Physical Disability Waiver, we're also looking at the percent of individuals that start services once they are authorized to do so to interrogate why they might not have started a service they are approved for. We can see, for example, that nursing services are harder to access than personal support services and how initiatives are progressing year to year. One limitation that we're working through is people who were assessed in one time period but received services in a following one. And that could just be how the calendars work, from month to month. Regardless of the limitations, using the same study period allows us to align data sources within and across programs. Jess, I'm sorry, you unmuted. Do you have a question or can we keep going?
No, I didn't mean to unmute.
Thought I was being so sly, paying attention. All right. So perfect. Slide 8. Rounding this theme out here is the preliminary data we have on the time elapsed from the date of completed assessment to the onset of services in the Section 19 Aging and Physical Disability Waiver and the Section 21 Comprehensive Services for Intellectual Disability / Autism Spectrum Disorder Waiver programs. Again, the data is not completely comparable because programs have different start dates, but we are working through those issues for publication this summer. Next slide.
So I do have a quick question because I know it's going to come up. Will these slides be made available to us?
Yes, we would be happy to share this PDF with everyone on the committee, although we do ask, please, that you do not share them or publish them, specifically because we're still working on the data collection and making sure that what we have is the final numbers.
Okay, just so you know, it's being recorded though.
That's fine.
People
It's
are,
a public,
and people are watching.
and people are watching. It's public data. What
So
we're
yeah,
hoping,
beyond that, yes.
what we're hoping happen is that this not, show up in the Portland newspaper of specific numbers, because these are, we're works in progress. So again, we're working on breaking out data by county to better identify issues or weak points in service types and provider types by county. Currently, the most up-to-date data that we have is in the most recent quadruple A report available online, and the link is on this slide for anyone who needs to find it. It's a really comprehensive report. There's a report from last year, and there's also the original committee's recommendation list, somewhere around 50 recommendations, which should really be of interest to this committee if anyone wants to check it out. All available on the same website there.
Abby, can I jump in? I don't know if this is the best place to ask the question, but
go for it. Yeah.
So in looking at the quadruple A data information and sort of what you're saying here, so there were sections broken out, and then there were like levels of care broken out, right? Like assisted housing, but I didn't see any data specific to section 21 or section 29 or, group homes, things specific to that sector. Is that something that is available, or is there a reason why that's not a part of the quadruple A report?
So I'm just trying to think. The quadruple A report answers questions from the original recommendation on workforce initiatives, as I understand it. So I think that some of those things may be in there, but maybe they're just not talked about specifically. There's also additional information on the OADS website. Is there a specific thing that you were looking for, piece of data that you were looking for that I might be able to look for?
So looking at, sort of table 3, it has, section 12, 1996, 63, 69, but there's nothing, sort of on 21, 20, or 29. And then when you're looking at the really on the group home data really is the number of licensed, but that gets really into the weeds of the assisted housing, I believe. So those are the things that I was curious to, and really more in this, what you're developing, like in this county measurement, how is it going to be broken out by Maine Care section? How are you going to, categorize the data?
I'm just taking a moment of silence here to write down your question, because I don't think that I have a great answer for you right now, but it's absolutely something I can find out and get back to you on.
Okay, I appreciate it.
All right, finished writing down the question. If we want to just go to the last slide, we can finish up, and then I can answer other questions and possibly bring back more to the department. So the last part of this new data that the department's looking for is under, part of the section 9817 FMAP American Rescue Plan funds. OADS plans to pilot a new experience of care survey with the HCBS waiver members. So the pilot is anticipated to begin this summer, 2023. The HCBS, it's called the CAPS survey, which is an acronym, CAHPS survey, was created by the Centers for Medicare and Medicaid Services and evaluates the experience of care by individuals receiving long-term services and supports from state Medicaid HCBS waiver programs. The HCBS CAPS survey is a cross-disability questionnaire targeted for adults with disabilities, which includes older adults or persons with physical disabilities, and adults with intellectual intellectual or developmental disabilities such as autism spectrum disorders, traumatic acquired brain injury, or other related conditions. And that's a survey that we will launch this summer. And as soon as data is available from that, it'll be on the OADS website as well. That is the full presentation. Happy to take questions, many of which I may need to bring back to the department, but happy to answer the ones that I have data on here.
Great, thank you, Abby. Are there questions for Abby? Well, I have some. Well, I have one anyway. I appreciate the AAA report. And I did, by the way, just so you know, because I don't know if you're seeing the chat or not, did share that report in the chat in case any of you did not notice that. And I'm really curious to sort of just dive down deeper to pursue, sort of this conversation about really starting to understand the number of hours. So we're seeing the percentage of people who are not staffed at all, and we're seeing sorry, because you've reported two different numbers, which is confusing, by the way. So in one instance, you've issued the number of unstaffed members and then the percentage of partially staffed members. So that in and of itself, I would just make a recommendation that you do one or the other and not shift them back and forth because it seems a little bit odd. But also what we don't know is, we might have an unstaffed member who needs 5 hours of care and a partially staffed member who's getting 5 hours of care but needs 40 hours of care. And so what is the possibility of starting to understand the numbers? And I think Catherine sort of piggybacks on Catherine's previous statement about, sort of we understand, at least from an evaluation perspective, or sort of that there's a certain number of hours that are allocated that are being unstaffed, and we could back into the number of workers that we might need to add by understanding the number of unstaffed hours across all of these settings. So presumably we have that, right, at a personal level. Betsy?
Yes. Yeah, I certainly have that at our level, Jess. And I think it would even be, if we're really going to gather the data, right, let's do it the right way. I'd say it's not only the number, but as we know, geographically, where are they, right? So I don't need 50 workers in Portland if I need some in Washington or Hancock or Piscataquis. So I could certainly provide that on that level of detail for us within our gaps of services. And then I completely agree in terms of consistency of data, and also just naming, because I have an unstaffed list and a wait list, which are two different things on my end, which do not correlate, I don't think, even to Betsy's service manager, maybe how you might be defining either of those as well. And so again, as we're collecting some of this, I think having some common nomenclature would obviously be helpful. So
yeah, I think that's true. And I Tom would probably agree with us too. The thought that came to mind was, I think this is great, by the way. And I haven't seen this before, which I'm a little surprised. But
I sent it out.
Well, no, but I haven't had conversations as a SCA,
Gotcha.
Service Coordination Agency, about this. But it's great information. I love it. But I wonder how granular it's going to get, because I think granularity in some of this is really important. And to Michael's point, there are certain pockets of the state of Maine that are almost impossible to staff people in. And other pockets where we actually seem to have plenty, we do pretty well. So I think it's important for us. It's good to get the aggregate, but to also have the ability to drill down and say, what might work in one area of the state to influence and increase the workforce, may not be effective in another part of the state, and it might take a different strategy. So just to ensure that we have the ability to get granular when we need to.
And Catherine, is that something that is possible for folks, for the providers in your world, to dig down
I think so. I believe so. We could do that.
on the number of, essentially the number of hours that are unstaffed?
Yeah, it's a little, it depends on the service, like it depends on the service. Let's just put, that's the sort of the problem is, like, if we're going to go about collecting data, we want to make sure it's really going to be of use, as opposed to just having all of this, sort of mismatched. When somebody is authorized by service units, that's good. Other types of care and other types of service, it's a little bit harder, but I think I'm kind of interested, Abby, like that county by county breakdown is really, I think there's just such great strides that the department is making in trying to collect data. Can you explain that once more of what that's going to entail?
I'm not sure if you froze or I did because of the bad reception, but I don't have a lot of additional information about the other county by, like, how the county by county data will be done. It would probably make sense at our next meeting or sometime in the future to have, especially once this data is no longer in the development draft stage, once it's actually published, to have someone talk to this committee. But as it's updated, I'm happy to take that question back to the department and see if we can flesh it out for you a little bit at the early stages here.
And was it this summer that you thought that data was going to be out?
Yes.
It might make sense to wait and see what that data for this group, that'll be the next time we meet, right? That theoretically.
We're going to meet in June, theoretically, again, I think, before the summer.
Okay.
And Abby, can you just speak to whether or not we can get to this granular level related to hours of unstaffed?
At this point, I'm not sure I have the answer that you're looking for with that. So it's a question that I'll bring back to the department, and I can probably formulate that in some sort of way to the committee before the June meeting.
I guess my question is, can't it just be I know this is not simple, but can it be a crosswalk of department approved hours and Maine Care remittance by person and then put into aggregate? It is that.
So, what you would be saying, what it doesn't do is to tell us how many it does. Maybe putting the two pieces together, you could do that. It's a pretty complicated thing to say that these are the total number of hours. And these are the numbers that were charged, right? Who are paid for, I suppose. Then you're getting an aggregate number of hours, but what we cannot tell in that formula, right, is where those consumers are, and whether they're unstaffed or partially staffed. So when we're looking at, I think we all want to say, and I'm so excited about the last piece that Abby just offered around, essentially the quality of care survey is really good. We want to get at whether or not people can get care where they live, whether we have these things called care deserts, which is what people are calling them, in some counties where you cannot gain access to home care right now. Or is it Portland, right? I know, Michael, you've got as many problems trying to staff people in Portland. as you do rurally, I think sometimes. So understanding where these people are and where we need to, I mean, that's going to help us understand, right, the solutions to trying to target some of our efforts at growing the workforce in certain regions of the state.
Jess, I don't want to put the cart before the horse here, but as we know, we're talking about seismic shifts here that takes a long time, and certainly as we collect data to proof points, you know, the longer sort of aggregate time period we have to be able to convey this. But so that's sort of my thought process as we're looking to gather data. I mean, absolutely, you know, the sort of unstaffed hours backing into the number of workforce. That it's just someone's earlier comment that kind of gets us to just this sort of meet quota, so to speak. That is not, you know, I think there's another level. There is another level of unmet need by our consumers that aren't even allowed hours. Is there a way that we can start capturing that data subsequently at the same time, so that, hey, let's raise the bar to meet our current capacity within our funding streams? But that does not mean that if we've met the care of our consumers, that there's a greater need to go above and beyond to actually meet their. And so what does that look like for a workforce, you know, to be able to grow to meet that sort of capacity? So for example, I mean, I'm allotted 2 hours a week. I know that that is not enough for my consumers, but I can back into say, all right, I need 150 more staff in X number of locations to meet that quota. But ideally or realistically, my consumers need, you know, 4 hours a week, 8 hours a week. And therefore, what's the workforce needed to provide that level of services, you know, as a continuing advocacy point? I'm just, again, that's certainly a much longer term goal, but I'm wondering, do we start building that ship and that data now as we continue on that continuum? So that's just a plug to put in there to consider.
Yeah, I would concur, Michael. And the other thing that we found during the pandemic with Meals on Wheels, for example, was that once we opened up the doors and said, we have more money, we can serve more people, guess what? There were lots more people who were actually eligible and needed the program. But because we try to be transparent and manage people's expectations, and I think we do this in the long-term services and support system too, is we know there's a scarcity of resource, whether it be people or money. And so, you know, I heard from a friend of mine just a couple of weeks ago that I referred her to getting an assessment, and she said that they were told that, you know, they'll do the assessment, but there aren't any workers, so it doesn't, probably don't get your hopes up. You know, so if that's the message, right, then you're probably have much more need than we know right now in the system.
Yeah, no question. And I, you know, I'll note for the record that we've got some absences today, you know, from folks that serve on the Essential Support Workforce Advisory Committee, including folks representing nursing home care and behavioral health. And so we haven't even gone into the depths of all the populations. I don't want to ask the question because I don't think there are people who can answer the questions here right now, but I do believe hopefully they can watch this and then we can come up with a plan for talking about those things. And I'll just say, you know, sort of the last piece which goes into this is that right, this is the bigger challenge is understanding not just the unmet need of the current clients, but unmet need of people, particularly essentially working families, people who, you know, have been lower wage, you know, or lower middle class earners their whole life are not going to be able to afford care. And that I've heard from a number of providers, for-profit, right? For-profit, don't take Maine Care, doing well, right? But their business model is stuck, right? They have hired as many people as they're going to hire, with the wages that they can pay, with the amount that they can charge for the place that they're in, right? So they're not going to grow, and so we're going to see an increasing demand that is not going to be met because they can't grow. there's a constriction here with not being able to pay out of pocket the amount versus, and so there's that other issue of understanding what is that, right? What is that number of people out there in the universe who need care, who can't get care, who are then gonna ultimately end up in the hospital. And, you know, where we're hearing this legislative session again, the numbers are so impressive of the number of people who are in the hospital who cannot be discharged because there's no home care and there's no facility care. So you know, it's not, I think we as an advisory council have to say it's not just you know, low-income people who are on Maine Care services. We also have to grow this workforce for everybody. So what questions do you all have for Abby and or the department in relation to or either of the departments? What's currently happening? I kind of would love to hear an update about anything DOL wise in relation to the Caring for Me initiative. I don't know if anybody can give us that update. Angelina, maybe.
The Caring for Me work, we have passed the baton over to our colleagues at DHHS to continue to drive the bus on that. I think it's a couple of different reasons. One, they had some more money to spend, so very exciting to be able to make that investment, and we were out. Two, they are coordinating a lot of other marketing efforts that are related and similar, and so being able to kind of have like one person making sure we're not accidentally competing with ourselves because of the way like Google Analytics works and the targeted SEM, which I think is a really powerful thing. And so I feel like I have in my calendar, I hope some of you do as well, we've got a meeting coming down the pipeline to debrief our Caring for Me advisory team about the transition and how some things are going. One thing that's really like, I'm so excited about this meeting because we have a favor to ask of some of you about recommending some folks who would maybe want to share a testimony of how the work is impactful to their lives. I feel like I just stole Abby's thunder. This is really, now that we've passed the baton, it's really an Abby thing and not an Angie thing. Although we are still working very much together on it and continue to feature our, hiring events, and especially hiring events that have employers in this area. Our healthcare navigators are seeing so many people. During this meeting, I got a couple of people filling out the form already. So that Caring for Me thing, it's still working. People are still very much engaging with the content, and our healthcare navigators are busier than ever.
Abby, do you have any other updates?
Not prepared in front of me, but on the 31st, Jess, I believe you're on the advisory council. So if you don't have that meeting on your calendar for the Pulse team to brief everyone on the advisory council for the Caring for Me campaign, please let me know, because you should have gotten that. Our advisory members are folks like yourself, and we're excited to share what we've done. It's been a big push, according to our marketing folks over at Pulse. The biggest time for many people to switch jobs is at the new year. So hopefully you have seen some of our Caring for Me advertisements. I've seen some on television and newspapers, print media across the state. I think there's always a push to want to advertise where the most eyeballs are for advertising firms. And we have strictly said, no, thank you. We would like to advertise across all counties, all places. And so that's a campaign that's ongoing, and we'll have more on that on the 31st.
Abby, do you have any sense of what level of jobs we're having the most success with? I was at a meeting where I think it was the Maine Caucus on Aging, the Legislative Caucus on Aging, and Paul, and it was another person from DOL that was there.
Yeah, it was Kim.
Kim. And they were reporting out on the jobs, but they didn't seem to be the jobs that, like in my sector, for example, we were looking to really get some traction. Is there any sense of where those What jobs people are most attracted to, I guess.
I don't know that I have any information on what jobs people are most attracted to. I know that we have been pushing since the handoff from the Caring for Me campaign from DOL to DHHS. We've been really pushing the MERT 1, the MERT C, the PSS and DSP positions specifically. And again, to Angie's point, we've been doing that in collaboration with other marketing efforts that are happening. There is a partnership ongoing between DHHS and the Live and Work in Maine folks. Also for entry-level jobs, the Live and Work in Maine campaign is in some aspects more focused on incoming dental roles, phlebotomy. So between the two campaigns, we're trying not to compete, but also target all of those folks. So I don't know that we have data on that, but that's a great question. And I'll look to see if that's already in the presentation, but we are trying to recruit those roles fairly aggressively.
We also try, one thing that I think is really interesting about Caring for Me is that it's pulling the jobs from the main job link that use very specific keywords that would be good direct care jobs, right? So like my favorite keyword, direct care. And so when what we've seen on the main job link on the back end, I've been trying to kind of get a sense for like how many people did actually click on this job. I can see how many people went there, but there's some limitations because you have to be kind of plugged in, you have to be logged into main job link for me to get more data about you if you're clicking on this link. And so sometimes the link clicks are a little bit, there's a layer of like, you might have clicked on your own job. That's cool. But I don't think you really care about yourself. You don't know how many other people outside of your IP address might have clicked on it or were curious about it. And so just trying to, that's something I can bring back to this group to show you what some of our top click jobs were in the main job link. And one thing that I'm really happy with is that we have seen that more of our top clicked jobs in the past throughout the campaign have been in the direct care industry, which is kind of nice. I mean, it's not 100% true across every job because some jobs are just have very cool titles, can't compete with them all the time, but we have seen an upwards trend of the people clicking at least in these direct care positions, which is nice.
So to both of you, and you know, clicks is one thing, and we were trying to dig down hard today on data, but to both of you, I mean, how would you even begin to think about measuring success of this campaign if we don't have numbers? Like, how do we know it's working?
Well, there's one piece of data that we do have a lot of control over. And so one of the most interesting outcomes to me about the Caring for Me campaign is really attracting people to this workforce. And so they don't necessarily know that they want to be a PSS or what does that acronym even mean? So a lot of people don't know how to get started. And so we have seen a lot of people click the button to get some more information and to hang out with our healthcare navigators. And those are people that we're really measuring a lot of data about. Did they get connected to training? Did they get connected to a free training? Did they get to talk about like a career pathway? What did they need to be successful? And so, although, you know, I think on our end, we can't tell if an employer got 100 more applications than they would have without us. That's not something that every employer is sharing with us. And it's not something that's easy to, it's not something we have at this point in time. But the folks who do have that, who do ask to speak with a healthcare navigator, we are tracking their success and offering that one-on-one support. We've seen a variety of people interact with our healthcare navigators and have some really exciting. And on the 31st, I have some data I'd like to share with you all then about like how that piece is going. And that's not the whole body of everybody, because not everybody wants a navigator to help them, but it is a really interesting group of folks who we are attracting to the field who didn't know what any of these acronyms meant and are really curious.
Abby, anything to add?
I mean, it seems to me, Jess, we want to go back to your earlier point as to at the end of the day, we want the vacancies filled so that consumers can be served. So finding that baseline and then being able to track that, I think, is really the essence of that's the end goal here, right?
Absolutely. And I have one more question about tracking, and I think it won't go to your folks, Michael, because your homemakers aren't certified, right?
Correct.
So, but bear with me on it for everybody else for a second. So Abby and Angie, I think, you know, as a matter of fact, just yesterday, somebody said to me, like, generally, not always, but generally the difference between what we're calling a direct care worker or a direct care and support worker and a healthcare worker is a license versus a certificate. So who the heck issues a certificate? And couldn't we measure that? I mean, like, if we're talking about people that get certified, who's issuing the certifications? Are we talking to the wrong people? And that could we measure that there are now, you know, there were 100 people who were certified as CNAs last year, and there were 120 people this year certified as CNAs. I mean, and is that a data point that we could be looking at?
Oh, I'm going to speak up and have hopefully Dan and Abby help correct the course, because I think I understand this and it's just like my chance to test it. So CNA is really interesting, right? Because there's a course and there's it has a credential of value affiliated with it, and it also has a license. So with the Maine Jobs Recovery Plan, we've been able to, with our partnership through the Maine Community College, open up more slots than ever for classes like this and fund kind of incomplete classes that normally might not have gone through because you needed a certain number of students to be affiliated with them. So we've seen an uptick in the number of classes available, an uptick in the number of folks enrolled in the classes, an uptick of the number of people who are then getting the credential of value. And then at DHHS, they're able to see how many people ended up getting the license. So MCCS has this really great, interesting pot of data about like slots, enrollment, credentials. DHHS has this really cool data about number of license issued. And then at MDOL, hopefully that data will trickle into our system to give us this sense of number of people in that position through the limitations that Mark presented to us all earlier. But I think one thing that I really like about this work is how we're all kind of coming together to address it. And I think Dan and Abby, did I get that right for at least in the example of CNA?
No, you got that exactly right. The only other thing I'd add to that is we can add the number of completers to that list, and we also can add the projections over the next 26 months that we plan to do open seats, enrolled, and completers. It's pretty impressive numbers.
That's great. I mean, that's a data point. So then the question is, like, is there one for DSP? Is there one for PSS? Is there one for MERT1? Like, how, you know, are there ways for us to start looking at those sorts of, if we have to look individually at the certifications?
We're going to capture some of those in our training offerings, but not all of them.
One thing that's really interesting is
sorry.
MCCS is doing quite a bit of contracting out to partners at adult education to do some of the trainings, and we've seen I've seen a few requests for kind of PSS, but mostly we'd prefer to get them a CNA license because the class is not that, because that's what people are also asking for, and it can help meet other needs. So that feels like I don't know that we can have, I think it's hard to pull the data specifically for PSS for us. And Abby, maybe are you with us still? If you could talk, if you'd be open to talking a little bit about some of the like DSP trainings.
Yeah, just to add on to this conversation, and I do apologize, my hotspot timed out here. But to talk about sort of some of the measurements, having a better system, a centralized system in place with the LMS system that we are looking to adopt will be an easier way of saying of tracking those numbers of how many people got trained along each one of these trainings, and how many people do we have working in the field, whose credentials, who's kept up with things. It's going to make that a lot easier as we go forward.
And what's the timing of that, Abby?
It's hard for us at the Office of Aging and Disability Services to say exactly until the Department of Health and Human Services picks their learning management system. Once they pick it, we can start nailing down timelines and things to tick off, but it is currently their RFP, their contracts to work through. And so once they have a date, we will have a date. You're making faces. The RFP was published, I think 2 months ago. They were in the vendor process, which is highly secretive. but I believe things are coming to an end sometime this month with a vendor getting chosen is my update from.
Yeah, no, I mean, it was, you said the department, so I just didn't know which department we were talking about. That was like, because I always think about you as the department, so.
That's a good point. Little D department, big D department, but the Department of Health and Human Services, it is their work directly sort of at a higher level. And then the Office of Aging and Disability Services is going to work with that LMS system and with the Division of Licensing and Certification to create a timeline for how quickly we can start, consolidating all of the records of certification that we have going and put, as much as we can online for classes, for resources, things like that.
I think that would be great. I do have a question though from the behavioral health, mental health side. There are residential folks that are working toward MERT 1s. Those are all individual components that lead to a certification. Now, the Center for Learning has to countersign all of those certificates that are issued by individual employers. Is there a way to kind of consider those data points as well?
At this point, what I can speak to is the consolidation and the efforts being done with PSS, DSP. The Office of Behavioral Health is doing sort of its own list of things to make sure that their training is high level. And I think that the plan is within a year to evaluate everything and try to pull it as much consolidation as we can across departments. But that will be more coordination that we're looking forward to with them when things are, more settled.
Okay, thank you.
Yeah, and I guess I would say the same from a data point for DSPs is that they go through the College of Direct Support, and there has to be a data that you pull out that how many people are credentialed. It doesn't really, I mean, I think that data, it sounds like, I mean, there's the CNA registry, and so there's CNAs that are certified and they're on the registry. Is that a data point we can pull over time? How many people are active on the registry? How many people are actively credentialed as a DSP? How many people are actively credentialed as a MHRT? And sounds like PSS might be a little less definitive, but I mean, those, or maybe I missed that data point, but it doesn't get to the uncredentialed, but that certainly has a lot of, that data is there. It already exists.
The data for the DSPs, because of the College of Direct Support, is absolutely there. The data for the PSS, I don't think that there's a centralized system. I know that there is a database maintained by the Division of Licensing and Certification. I don't know how easy it is for them to pull in folks who have gone through the training, folks who are credentialed, folks who are currently working, sort of the specifics of the PSS credential. But that's something that we can ask the Division of Licensing and Certification.
So I think, Jess, I'm going to do the facilitation for the last hour. Okay, gonna give Jess a break here. And if we want to just sort of move, actually last 39 minutes, let's see. If we want to just sort of move along in the agenda, I think the last bit of time we have together would be good to, go try to establish some short, medium, long range goals or priorities for the group. Maybe also just sort of think about our meetings in the future, and if we can land on and maybe not necessarily here, but conceptually land on the third Wednesday of such and such a month or whatnot to try to organize that scheduling component. And so just to start off on that, this group is working through January of 2028. So, sort of 5 more years. And whether does it kind of make sense to think of our priorities as far as like a 1-year priority, a 3-year priority, a 5-year priority, and just kind of, I think if we can spend this time kind of brainstorming, what is it that we want to spend, just to do the 1 year, where do we want to get at in our year? I know we're in year 2, but that year is already come and gone. And so here we are. Thoughts?
Catherine, if you were looking for a time, I think these Wednesdays afternoons, especially if we are able to return live, seem a good block. So to the extent you're looking for feedback, I've kind of already started to block this out long-term, and I would support it.
So the
And I
third
would-
Wednesday from 1 to 4.
Yeah, with the idea that we could hopefully be back to live or hybrid
Right.
at MDOL as originally planned for today.
Yeah.
I would agree, Tom, and I think it would be great if we could get them a few at a time in our calendars ahead of time.
Yeah.
That would be helpful.
Absolutely.
I feel like in the short run, you know, it's really finding out what all the data, figuring out what all the data points are, I think is going to be really important. And to agree that those are the measurements and to figure out where they're, I mean, I think we did some of this today, figuring out where there are gaps, but really nailing that down, I think in the next meeting or two is really important, because then we can, I think this group is advisory, and I think we're supposed to be sort of reviewing and, you know, kind of asking, where are we? And maybe we revisit the roadmap and go back and spend some time at a meeting doing what Tom was alluding to earlier, is refreshing ourselves on all of those activities that were came out of that commission's report, and all the things that the legislature has, you know, given direction to work on this issue. And so that we all really kind of get refreshed again about what are those things, and what are the things that are immediate, what are the things that are more intermediate, and then what are the things that are more long-term. And that might help us to figure out how we best spend our time over the next couple of years anyway. And I'm going to apologize right now. I can only be on for 5 more minutes, so that's why I jumped in and gave my 2 cents.
I'll grab the microphone before Betsy departs. Yes, I did want to say thank you, Abby Stivers, for that report. And thank you, Jess, for reminding me of the actual purpose of this committee. It's modified my thinking somewhat, but I think it brings us back to that. I think that, you know, per Betsy Sorry-Mantra's comments, I think everything in the Abby Stivers and the department report is wonderful. I think what would be motivating to us is to deep down digest that and then focus at the next meeting, maybe some short-term goals for this group. You know, Catherine, 5 years, I hope we don't go 5 years before we come up with some good recommendations. But maybe short-term, and I think this data will help us. But, you know, in terms of what we do with it, between now and the next meeting, I'm going to go back and look at the reports from before and refresh my memory, so I come ready and charged up for that.
Well, I'm just going to jump in and I'm going to share my screen here, and for everybody watching at home too. You know, these are the things that we have been charged with doing, which is, you know, collaborating with our partners here to you know, examine staffing needs across regions for essential support workers, and make recommendations in relation to recruitment and retention of essential support workers, monitor the worker shortage. And again, understanding what that worker shortage is important, and the expansion of the workforce, and make recommendations to the department and legislature about additional research needed in relation to the expansion, collect data related to the workforce, address the benefits cliff, which is a pretty specific issue, and then obviously make recommendations to legislature if any legislation is needed. So, you know, I think we came up with some interesting actions already today that I think we could try to summarize, but that's a lot of work there. So would be really interested in hearing from all of you what your priorities are, but let's just say between now and the end of the year.
I mean, I can wait. And my priority is to establish data points, agreed upon data points between, you know, the various, you know, the DOL, DHHS, and, you know, the Institutes of Learning, Higher Education, and then be able to measure against that. And so, I think sounds to me like there's been a lot of work in that area. I think it, so I think if we came out of the end of this year with agreed upon ways to measure this workforce moving forward, we would really have accomplished a lot. That would be my goal.
And getting back to some of the data points, Jess, I was reminded with your, bringing up that screen there is it's not only who we're bringing to the workforce, are we moving the needle on that? How's that match the unmet need? But there's sort of that subset of data of the retention, the turnover. I know I spoke about it at the caucus, right? I mean, I'm getting some staff there, but I'm losing 50, 60, 70% of them within, a few weeks or months, that doesn't move the needle at the end of the day too. So that's another piece that could be helpful. Obtaining that, I think, to me, seems secondary in terms of that's more of on a programmatic potentially or agency level to try to have some retention, if you will. I mean, we need to bring the people there first and do the best we can to keep. But I think it'd be good data to know what sort of turnover rate are we having within this field across the sector as well. So, again, just looking upstream, I know that might be a year 4 or 5 kind of thing, but I do think it would be valuable. Because if we got hold in the bottom, we just keep throwing it in, it's just going to come out the other end, right? So
I agree with
know
you,
where those
Michael.
folks are, how big they are, at least.
I agree. I think we have to figure out why can't we retain, if we can't retain people, what are the reasons they're leaving? I think we do have to have some qualitative data as well as quantitative data. So maybe there's some data points that we need, Jess and Catherine, around, having, what are the exit interviews saying when people leave jobs? What's driving them away?
And I don't want to put you on the spot, Stephanie, but I am curious if the Worker Advisory Council has had any conversation about doing any survey work or any broader conversation with workers around what keeps them versus what causes them to move to other jobs.
It hasn't, as far as the advisory committee goes. I know it's something that we've been doing here at NRS, but it is something that'll bring to the committee. Looking for data for that. Absolutely.
I just think we've got this wonderful wealth of advisors in that council. So yeah. if we could find some way, and I think this idea came up before, but maybe even at some point hold a joint session of this committee with the workers, just around a particular issue. For instance, like retention. Maybe we could have workers advise us about the things we should be focused on.
Duly noted. I will bring it to the committee. Council.
Anyone else have any feedback on priorities? I think having an understanding of what the goals and priorities of DOL and DHHS are and what they're using for their measurements and how they're measuring success would be helpful.
I know we lost Abby.
Oh yeah, she's a trooper to have stayed on that long, I gotta say.
I can't even imagine. Yeah, that's a long time to have a meeting in your car. But I am really curious. One of the pieces I always like to do is to look to what's happening in other sectors that's successful. And so I'm thinking about, I know there are some childcare specific programs through TANF that are, sort of intended to bring workers in and keep workers. And I'm wondering about, if there are any models within, DHHS that are working with other sectors that we could think about deploying with this sector. And that, sort of gets at the benefits issue, that's definitely a sort of a short-term thing I would like to explore.
So anything else we're missing here on the priorities? Do we want to take a few minutes and talk a little bit about what sort of, from a data perspective, what do we want? Where did we land? Did we, what were the things that we people left to go get more information on? And then just talk a little bit about our agenda for next meeting. And so maybe Jess, you made a list.
I didn't make a list except in my head, but Catalina, I think you're taking minutes, is that right? Yeah. So Catalina is taking minutes, but I do think, one of the sort of short-term takeaways is for us to get a group together to meet with Mark. And I think that would be really helpful to really, as I heard it several times today, at least let's write down. Let's just write it down, all of the jobs we're talking about. And then, and then run them through the formula and see if they are landing in the codes. And then also see if we could do a little benchmarking. And I get that it's not, I understand all the limitations of what you've offered for data, although you'll probably have to remind me again and again. But I think that's some work we could do in between meetings, is to try to sort those things out so that we could come back and say, this is good, or we might want to think about a different recommendation in terms of we really need to, we need to come to that place of what's happening right now for data collection is appropriate, and this is what we're going to use for baseline, or we're going to have to recommend that we do something different, right? That we collect data in a different way. So I don't think we're at that place yet because we have more questions than we have answers from this meeting. But hopefully next meeting we can drill down on that a little bit and then make some decisions about what we want to do with data. Does that make sense to everybody?
Yeah, absolutely. I think that's the crux of it. And yeah, let's figure those points out, figure out what we can collect and reasonably analyze and use those points going forward.
And I think it's implied within this, but having a list of what positions, or what credentials or non-credential, and with it comes a job title that we are tracking and measuring and recommending on, I think would be helpful, and that would be part. So Mark, are you willing? That's kind of that ask of, if we give you a list of positions, job titles, would you be able to tell us where they fit into the occupational industry and the occupational data?
Yes, absolutely.
Catherine, I have a question on that point. It's clear. Could you explain a little more, with a little more detail, what the issue was? Because you did raise that very point right at the beginning when Mark was going through the data. And I recall that there was nothing, the data wasn't really lining up with the specific titles of the workforce we have in mind. Was that
Right.
your concern?
Yeah, so, yeah, so my understanding is that Mark's group's data is from the federal codes. And so what states do is they take the data they've given and say that they got data on a DSP and a PSS and a home health aide. They stick them into one of those three, and there are others, but those are the three that Mark felt were the most like our field. And so what we wanted was just a little more confirmation was if it's a PSS, and somebody's giving you data on a PSS, are you sticking that in the home? I don't remember what they are, but I remember the nursing assistant, the home health aide and assistant, or are they going under the social welfare? And so we have a real clarity of what each of those three categories are. Each of those three categories are regarding where the positions that we hire for go into. Does that make any more sense?
Yeah, I think the only trigger might be, I'd be interested to see, are we missing some of the workforce, because we have the personal care attendants who don't have any one of those in this.
Personal care, right?
Yeah.
So we need to, maybe we need to do a survey out to this group of, I don't know, maybe it's not even a survey, but like, let's make a collective list of what all.
Yeah. What I was wondering, Catherine, is whether Jess can remember, did we already do that? Because we started using the term direct care worker because Jess repeatedly said, hey, this is one rising tide is going to float all boats across the spectrum of care. And on the spectrum of care, I remember we started using the term direct care worker rather than any one of those subtitles because problems were across the board. Not recall, Jess, whether we found a way to track all the different categories of where all those potential workers were, but I do recall that we were concerned to catch them across the spectrum.
Yeah, and I'm sorry, I was a little bit distracted. I mean, we have sort of landed on calling workers essential support and care, or care and support workers, for the very reason that different workers do different things. DSPs, I was talking with a CEO of an organization that supports people with intellectual disabilities yesterday, and she's like, that's very much the work that they do, is to support, not care for. And it's not to say that there doesn't become a moment in time when it's caring. So I've really personally started saying care and support. So direct care and support workers, because I think it's both. I think that the folks that the people who serve older adults, which is sort of the place that I come from, tends to be more care. And the workers say that's the key, right? That's the work that Brenda Gallant did, NDOL did with the worker survey. That's what they say, they're carers across the board, and that's one of the key pieces. So I think we don't want to let that word go. But I mean, I think there's a lot of people who see their role as support, and including with behavioral health. So
But I think the question is there a list of what goes into that bucket?
Yeah.
Well, there's a statute. So there is a statute, and it says, and I'll share it with you in just one quick second, because we defined essential support worker.
But it's not like carried over to a credential.
It's not carried. It is not. Nope. Where the list would come, and it I mean really exists, where the list would come would be through probably the office of OFPR. I mean, no, not professional responsibility, the Office of the Budget. Because all of those folk, all of the positions that are tied to the 125%, the quadruple A, are the ones that we're talking about. So, I mean, there are ways to statutorily identify within the budget what lines we're talking about.
Yes, if you could share that ultimately before the next meeting, that is what I was talking about.
Okay,
And
perfect.
my
Yes.
point was, is that includes a group, Catherine, that are not credentialed.
Right, okay.
It
And
does.
so the direct care and support workers, and I do recall that now that you mentioned it, Jess, the panoply of direct care and support workers is broader than certified credential.
Are they identified by Maine Care section?
They're identified by that statute, which says the goal is 125% of the minimum wage.
So it's the downside for this conversation, because we all agree that this type of worker is this type of worker. And if Mallory Shaughnessy were here, we were just hanging out with her last night. We all agree that, you know, in the behavioral health, intellectual disabilities, aging services world, there is a worker that we all call a direct support and care worker. And they work for different populations and in different settings, but they're the same, you know, and it's not just that they do move back and forth between serving populations. And so what we don't want to do is set up a situation where we are competing, right? We're making, you know, the intellectual disabilities work the gold standard, and everybody wants to go work there because they get more money and it's a better job. That's what we don't want to do. We want to lift all boats, right? We want to make all of these jobs quality. We want to value all of these workers in an appropriate way. And that's, you know, kind of why we've tried to do this. In the aging services world, we have Michael and the Homemaker program, which is a state-funded program, which you don't have in the intellectual disabilities world. We also have Section 63, which is a state-funded home-based care program. So it's not that neat as a Maine Care, because we have decided in Maine to pay for some people getting services, because if they didn't get it, they would cost us more being in a nursing home.
Right. But Michael's folks that are homemakers are captured under Mark's data, under the occupational data theoretically, but that's why we kind of need, we need a list of you know, I don't care if they got letters behind their name or they got, but we need a list of the workers, and especially if we want to be measuring data, you know,
that's what triggered my thought, Catherine.
Yeah. Okay.
If we're looking for a data point, we want to make sure we capture the entire workforce we're talking about, and it's broader than the credentialed folks that you were rattling off. That was the point.
Okay, so we wanna kind of gather that up and make sure that so that's something.
So yeah, I just dropped the statute with the definition in there. Yes, and I don't want to just derail the conversation, but I have been hearing for some folks who are listening in, and I think there's no cure for the problem today, but I would love to get your agreement, everybody who's here, that we'll offer some period of time in all of our subsequent meetings for public comment or public question, because that's normal and customary, I think, in these sorts of committee settings. And certainly we did that with the commission. You know, people had an opportunity that weren't on the commission to weigh in. And it seems like an appropriate thing to do. So just if we're in person next time, or we end up in Zoom again, if we can just find some way to make sure that we have, you know, like leave the last 10 minutes of the meeting for public comment.
Yeah, or perhaps the Q&A function under like under Zoom, but Angelina, you had your hand up and now you're on under mute, so I'm gonna go.
Well, if attendees wanted to raise their hand, I would be able to give them, we could allow for public comment right now on this platform. That's definitely a possibility. So what, I don't know how to, I'm happy to try to manage the hand raising and giving them the ability to speak, and then they'll have to unmute and they'll be able to comment. So that's something we could do today if you wanted to, and also something we can always do in the future as well. And then I want to throw out there's these things, like there's lots of jobs I think we are all like, yeah, obviously DSP, that's essential care. Yeah, PSS, of course, obviously, like none of us would, but there's a couple of like RBT acre specialists that feel to me like they really fit in this category, but they're sometimes excluded. And those are credentials that we've got some ability to track as well. So I just want to throw that out there into those of you who are going to continue having conversations. I want to flag those two as things that I want to make sure we have a chance to consider, because they're not quite as obvious.
What is that?
What's RBT?
Registered behavior technician.
Okay.
It's kind of like
oh, go ahead.
A bonus BHP, more than a BHP.
A bonus BHP, and they might already be in there. I don't know. I mean, that's the thing, is like we relied on the behavioral health folks to say how they defined a direct care worker within the context of this. So
is the ACRE the employment specialist?
Yes, the ACRE is the employment specialist position.
That's like a DSP on. They have to be a DSP first.
Yeah,
DSP on steroids. Okay.
I'm all for more, by the way, not less.
Well, and it seems to me too, is that not only do we want to be inclusive of our list, but if we were trying to crosswalk this, Mark, with your buckets, we also run the risk of there's going to be other jobs in there which are not applicable to us. So if we're looking at data trends, it's not going to be a one-to-one correlation, right? Like we could have pieces of data that are driving that have nothing to do with us and could give us misinformation. So I'm more along the lines of, if possible, let's get that all-encompassing list, but utilize those data points, Mark, like you mentioned, to potentially work on a more consultative basis to try to have that specific data that we're really looking for. I mean, ideal world, yes, but an easy crosswalk to at least the buckets that's already in place would give us some good general trends, certainly as a starting point for sure.
So we have a meeting with Mark to do between now and the next meeting. So if people are interested, maybe reach out to Jess and let them know if you want to do a little more deeper dive and on that, or just throw it in the chat. I think
the other thing I heard, Catherine, is a to-do was sort of maybe a one-on-one conversation with the department and you and somebody from behavioral health to sort of say, this AAA, quadruple A report is great, but it leaves out, right, these other worker types that we would really like to see the data on in the same, sort of similar way. At least start the conversation, and maybe we could report back about whether that's possible or not.
Yeah, and I think would it make sense to put in that bucket and Abby's back? So we were giving you kudos, Abby, for staying on as long as you were on a hotspot in a car. And so pulling out the potential points of data around registry and the DSP credential, the registry, the BH, the different potential credentialing data points there are. With that, Abby, would you be the person that could help with that?
Yeah, I can certainly take back those questions to the department and see what I can come up with, and see what they say about what's available, what will be available, and then what's not available, so that we can have that as the.
Okay.
Even great if we could have a little subgroup meeting with folks, just so we could be a back and forth conversation about what's possible. Would be great.
And did I hear you say that behavioral health is feeling a little neglected in the quadruple A report too?
I think that's right. I mean,
that would be correct.
Okay, thanks.
Don says yes.
All right. So So
4
why
out of
don't you
5 say
circle
yes.
back and so circle back with Abby on that a little bit more, and so that can do some, we can do some side working on that.
And might we ask folks if there are people who are watching who have questions and or comments they want to offer, to raise your hand. Not to stop you, Catherine, from moving forward to the end, but
No. This would be, I think this would be a good time. And while people are doing that, are there any other sort of to-dos that we want to, I mean, super looking forward to the continued development of data from the department. So would love to have a report back on that. There was another, the FMAP data set too, that Abby was gonna provide us if she gets that. So, right.
I'm very
I see.
curious about timing too. That's definitely one of those pieces.
Yeah.
So when some of these things are going to happen.
I see Jillian. Angelina must have promoted Jillian. Jillian, do you want to come off mute and ask your question or make your comment? And hello.
Hello.
Hey, Jillian.
Hi, sorry. It's always
That's okay.
technical difficulties. I just had a few comments just after listening. I will already tell you that the playing field is not level because the systems aren't level, right? So when we got like the DLS rate, they're getting a lot more than PSSs and DSPs. So just something to consider, the rate was considerable. But it's because of the overhead and the supervisor and the administrative overhead, because it's not set up like DSP and PSSs with pre-authorized services. We have to get them authorized. So just pointing that out, our goal, all of us, was to level that playing field. And when the rates came in, it just didn't happen because the rate was substantially higher than any other rate we received. So DLS is right.
DLS?
Some of them are getting almost 20 or 22 an hour.
What can you tell me what a DLS is? I probably the only person that don't know.
Daily living skills. It's the entry level worker that was overlooked during that presentation that was done in the beginning here, because no other state has community mental health workers that go to the home that are entry level equal to a PSS and a DSP, but in the mental health world. They work with people, with adults with behavioral concerns, schizophrenia, bipolar. So when they did the benchmark for the study, there's no benchmark data about rates of reimbursement for those services because they just don't exist in other states. I guess Maine is pretty unique with delivering that service. I don't know where it comes from. Mallory would have to speak to that if it's like, if it's our high level of mental health or what it is. But just so you know, DLS and skills right out of the gate, their skills is up to $24 an hour. So because our reimbursement was over $70 something an hour. So there's already an uneven playing field, and I'm just throwing that out there because my goal when I sat on the commission was hoping that I could get DSP, PSS, and DLS identically with a universal training and moving through, and so they could, even the problem that we see with resignations is you can't guarantee full-time work. Well, I could guarantee work if I would have had that portability to move them from a PSS to a DSP to a DLS, but I can't because I don't have the rule rewrite to do that. So a lot of the turnover was people, you can't give them 40 hours, especially with DLS. It has the significant high cancellation rate because they're mentally ill and there's work that they have to do, and it's hands-off care, just so you know, Catherine. There's no personal care in it. It's working towards goals of like grocery shopping without having a panic attack in that, and you have to, and it's time limited. You're supposed to go in and hopefully within 365 days you have a member that's totally on their own, but that just doesn't happen. But I was just thinking of all the types of things, but yeah. And then I thought, you guys are, of course, all these positions that you're talking about, they do have certificates. I'm not aware that they approved anybody. Like I don't know that maintenance staff got approved or dietary aids. I know when I looked at the bill, that was much different than the one that we, like when we were choosing the disciplines on that committee, we were limited. They wouldn't let us talk about anything other than what we were there to do, which was DSP and kind of PSS, right? CNA. They didn't let us talk about behavioral health. But then after we left that committee, somehow Mallory was able to collaborate and get mental health added. So there are very clear disciplines that were part of this workforce, and there's a list of them. And it like our peer support specialists were included in that, $1,730, $1,740 increase. So just letting you know, they did all seem to be tied to some level of certificate. And what I'm trying to say, that those certificates would go through licensing for PSS, and DSP goes through, I don't know, Catherine could tell you, there's a training, Elsevier. So
yeah,
it's all tracked somewhere.
Right.
It's just
So
aggregating the data.
Right. So Jillian, that's what we're gonna try to, Abby has agreed kindly to meet with us outside, and we'll try to get a little more framework around what that data is available. And I think it's helpful for us to hear about those other positions that are out there. So thank you.
And I did just one more thing, like when you talk about them being certified and licensed, don't forget the other avenue of data, which I don't know that they'd let you aggregate, because I sat on the Maine background check committee when we developed it. That data is all sitting somewhere in someone's computer. Every time we offer a job and then the person quits or is fired, we have to take it out. So behind the scenes, the department has all the data you're talking about of these workers, and it's compiled by their job title, whether or not you made them an offer. It's there. I just don't know how you, but it's there.
Okay.
And obviously it's there for a reason. Somebody's trying to aggregate something, or they wouldn't have created this one-stop shop for the background check.
That was actually created under the Obama administration, and for a totally different reason, and all states did it ultimately. So thank you, Jillian. And I just am aware it's 4:00. So we probably should wrap up, but that's like a brilliant idea, by the way, to mine the background check program. I hadn't ever thought about that, but it's a really, really good idea.
Great. So as we're wrapping up, appreciate everybody's time. Hopefully we'll all be in person next time. It'll be June 21st, looks like, if we're going on the third Wednesday from 1 to 4, and really appreciate everybody's input, time. Jess, I don't know if you have any closing comments or thoughts as we head out.
No, I just appreciate all of you being willing to serve on this committee, and your thoughts today and your good work moving forward. It's really important that we solve for this. And thank you. Special thanks to Mark for being here all through the meeting, and for being willing to help us through some of this data work. So have a great day, everybody.
All right, take care.
Stay warm and get your power back, Abby. Take care.
Thanks, everyone.